Hello, this is Dylan Bailey, and this is a presentation on muscular dystrophy. So, to start, we're going to talk about what muscular dystrophy is. And muscular dystrophy is a group of diseases that cause progressive weakness and loss of muscle mass. In muscular dystrophy, abnormal genes, mutations, interfere with the production of proteins needed to form healthy muscle. Um, Duchenne muscular dystrophy, or DMD, is an X-linked recessive disorder caused by mutations in a dystrophin gene. The mutation causes a defect in the synthesis of the protein dystrophin, leading to progressive degeneration of muscles all over the body. There are many kinds of muscular dystrophy, each affecting specific muscle groups with signs and symptoms appearing at different ages and varying in severity. So, to start with some of the kinds of muscular dystrophy, the first type is, like I said, Duchenne muscular dystrophy, otherwise known as DMD. And once again, DMD is a genetic disorder characterized by progressive muscle degeneration and weakness due to the alterations of the protein called dystrophin. Dystrophin helps keep muscles intact, and DMD is one of four conditions known as dystrophinopathies. Research has identified a particular gene on the X chromosome that, when flawed or mutated, leads to DMD. The lack of dystrophin protein in muscle cells causes them to be fragile and easily damaged. This is the most common form and it is much more common in boys than girls. And if you look to this image on the right here, it gives you a demonstration of a healthy muscle. And on the one on the right shows the absence of functional dystrophin. And as a result, it's a unhealthy muscle structure with not as good function. So it just pretty much shows the loss of muscle integrity from DMD. Another type of muscular dystrophy is the Becker muscular dystrophy. Um, so, in comparison, muscular dystrophy and Becker muscular dystrophy, or BMD, are both X-linked recessive disorders caused by mutations of the DMD gene. Um, so, in DMD patients, dystrophin is virtually absent, while BMD patients have about 10 to 40% of the normal amount. So they're pretty much they're similar, but they're different in the fact that BMD patients do have some dystrophin in the muscle cells. Um, the signs and symptoms are pretty much the same to DMD, but they tend to be milder and progress much slower. Symptoms generally begin in the teens, but they might not occur until the mid 20s or later. And we'll get into the symptoms of muscular dystrophy in a little bit. So there's some other types of muscular dystrophy. The ones I included, the first are myotonic. This is characterized by an inability to relax muscles following contractions. And in this type of muscular dystrophy, facial and neck muscles are usually the first to be affected. People with this form typically have long, thin faces, drooping eyelids, and swan-like necks. So if you look at this first picture, top left, this is a patient with myotonic dystrophy, and you can see in the picture you can see the eyes and the neck and face muscles, as well as the breast area, chest area, how it's affected from this type of dystrophy. Another kind is facioscapulohumeral, or FSHD. And in this type, muscle weaknesses typically begin in the face, hip, and shoulders. This type also has shoulder blades that might stick out like wings when their arms are raised. And onset usually occurs in the teenage years, but can begin in childhood or as late as 50 years old. And if you look at the top right, this image right here, you can see how it talks about how the neck and shoulder blades look like a wing when the arms are raised. It's a pretty good picture to demonstrate that type of muscular dystrophy. Another type is congenital. This type affects boys and girls and is apparent at birth or before the age of 2. Some forms progress slowly and cause only mild disability, while others progress more rapidly and can cause severe impairment. And this third picture on the bottom left is an example of congenital in a young child there. And finally, another type is the limb girdle type, where hip and shoulder muscles are usually affected first. People with this type of muscular dystrophy might have difficulty lifting the front part of the foot, so they might trip more frequently than others. And the onset from this type usually begins in childhood or the teenage years. And finally, our last picture on the bottom right here will show you limb girdle muscular dystrophy. Okay, so now I want to talk about the progression of Duchenne muscular dystrophy. So it starts in the early phase, which is up to age 7. And during this phase, children have trouble with certain activities such as sitting, walking, and talking. So pretty much just the basic activities of a young child. The next phase is the transitional phase, which ranges through the ages of 6 to 9. And in this phase, a child with Duchenne will experience increasing weakness in his muscles or her muscles. He may also or she may also have trouble moving as easily as a healthy child compared to others. The next phase is the loss of ambulation phase, which usually occurs in the age of 10 to 14. In this phase, children with Duchenne experience the largest impact of their independence as they become more and more dependent on a wheelchair. So pretty much in this phase, a patient becomes more dependent on other types of help, such as a wheelchair, possibly crutches. They're pretty much starting to lose their function. And in the adult phase, which is the final phase, from age 15 and up, there is usually increased difficulty in breathing. And this is also where life-threatening heart and lung conditions are more likely to happen. Regular heart and lung monitoring is required during this phase. Okay, so here are some of the symptoms of muscular dystrophy. And this image does a really good job at showing the body type of a person with muscular dystrophy. Um, so if you give a look at some of the pointers here, one of them is sway back, and you can see how the back is kind of arched. Um, it shows where the muscle weaknesses will be. If you look at the, excuse me, if you look at the knees, you look at the legs, the feet, you can see where the weaknesses are from this image. So it's very useful. And some of the other symptoms of muscular dystrophy are frequent falls, Gower's sign, difficulty rising and lying at a sitting position, trouble running and jumping, waddling gait, walking on the toes, large calf muscles, muscle pain and stiffness, learning disabilities, delayed growth, and shortness of breath. So as you can see, there are many variety of different types of symptoms for muscular dystrophy. Okay, so now I want to go into the diagnosis of muscular dystrophy. There's many ways to diagnose it. One of them is an enzyme test. So damaged muscles release enzymes such as creatine kinase into your blood. In a person who hasn't had a traumatic injury, high blood level of it suggests muscle disease. Another way is genetic testing, where blood samples can be examined for mutations in some of the genes that cause types of muscular dystrophy. A muscle biopsy is a small piece of muscle that can be removed through an incision or with a hollow needle, and the analysis of the tissue sample can distinguish muscular dystrophies from other muscular diseases. Heart monitor tests, such as the electrocardiograph and electrocardiogram, are tests that are used to check heart function, especially in people diagnosed with myotonic muscular dystrophy. Another is lung monitor tests. These tests are used to check the lung function. And like I said, one of the symptoms and complications of people with muscular dystrophy include just respiratory issues, shortness of breath, stuff like that. Finally, the electromyography is where an electrode needle is inserted into the muscle to be tested. Electroactivity is measured as you relax and as you gently tighten the muscle. Changes in these patterns of electroactivity can confirm a muscle disease. Okay, so let's get into the medication and treatment for muscular dystrophy. So there is no cure for muscular dystrophy. However, there are treatments and medications. Some of the treatment options include medications, physical or occupational therapy, as well as surgical processes and other processes involved. Some patients may need to see a pulmonologist, cardiologist, or even an endocrinologist for muscular dystrophy. And some of the medications include corticosteroids, such as prednisone and deflaxacort, which can help muscular strength and delay the progression of certain types of muscular dystrophy. Okay, so muscular dystrophy and exercise. So strength is normally within the limits early in the disease, and strength loss coincides with loss of functional capacities. During doing some research, there's conflicting answers on whether exercise is good for muscular dystrophy or not. However, exercise can help build muscle or skeletal muscle and keep the cardiovascular system healthy, and just pretty much contribute to general health and feeling better. But in muscular dystrophy, too much exercise could damage the muscle, as well as if a patient were to do an exercise and they did it with not the proper form, it could end up with them having an injury. And people with muscular dystrophy are it's much more difficult for them to come back from that because their muscles are already weakened. Okay, so this case study I came up with, and let's start with the patient details. So Michael is a 17-year-old male who uses a wheelchair, presenting a diagnosis of Duchenne muscular dystrophy. He states that he deals with pain and stiffness in the hands. He's also dealt with troubled breathing and shortness of breath. So his risk and stratification group is Duchenne muscular dystrophy, as well as respiratory complications. So some of the goals I came up with for this patient, short term, we're looking to increase Michael's range of motion by 4 degrees within 3 weeks, as well as increase his strength in his hands. We also want to begin ventilation training after doing some testing um, for that. In the long term, we want to increase Michael's range of motion and strength in the hands to the point of no pain. We believe it'll be around an 8 to 10 week process. Um, we also want to have Michael develop a normal breathing pattern after 10 weeks. We classified a normal breathing pattern with a respiratory rate between 12 to 20 breaths. Some considerations we have: cardiac issues accompany some forms of muscular dystrophy, which may limit your exercise capacity. So we want to watch out for that. Okay, so exercise testing. Okay, so exercise testing for this patient, we wanted to do the grip strength test. The grip strength test is a measure of muscular strength or maximum force that can be generated by the forearm muscles. So the next test we also wanted to do was the sniff test. And the sniff test is a test that tests your esophageal pressure and measures the respiratory muscle strength, especially the inspiratory muscle and diaphragm. And if you look to the right of these two images, the first image shows the sniff test and how it's used, as well as the second one for the grip strength test. And I also wanted to include other cases, other tests for other cases. So an assisted 6-minute cycling test, which requires the use of both the legs and the arms, is a good method to assess endurance for boys or girls with Duchenne muscular dystrophy. Another is the modified 6-minute walk test, which is another good one for children with DMD. Okay, the exercise prescription I came up with for this patient, we'll start with ventilatory muscle strength training. That was the first exercise. Frequency of 3 times per week with an intensity of 50 to 75% maximum inspiratory pressure. We wanted to do 8 to 10 reps for 2 to 3 sets. And the type is using a threshold inspiratory muscle trainer. The next was ventilatory muscle endurance training. We also did 3 times a week, 50 to 75% maximum sustainable ventilation, and for a time of 10 to 12 minutes. This was also using a threshold inspiratory muscle trainer. The final exercise was the lung volume recruitment. We wanted to do it two times a day with the intensity of 2 to 4 times, and we wanted to fill the lungs each time. We wanted to do 3 to 5 cycles, and we wanted to use a bag valve mask. And for the hand and arm strengthening, we wanted to use a couple stretches here: the finger flexor stretch, praying hands, raised fist stretch, forearm pronator stretch. And these are all static stretches that we're going to use 2 times for 30 seconds, 3 times a day. And we're going to stretch to slight discomfort and 30 seconds each time. So in conclusion, the estimated prevalence of Duchenne and Becker muscular dystrophy was 1 in every 7,250 males from the ages of 5 to 24. The prevalence of Duchenne muscular dystrophy was 3 times higher than the prevalence of muscular dystrophy. And this is data that ranges back to 2010. So to learn more about muscular dystrophy, I encourage you to go to CDC's website. And I also put a resource here, Muscular Dystrophy Association, if you ever want to lend a helping hand. Here are some references for you. Thank you.